Yes.
Well, good afternoon, everyone, and welcome back to our 2:30 update. Our battle against this pandemic has been waged on two fronts. The first is what most immediately comes to mind, and that's protecting the health and safety of our communities. But the second front is also critical: mitigation of the economic impacts of this pandemic on our residents and on the small businesses who employ them. I've directed my staff and agency directors to do everything in our power to help our residents who are hurting. That includes directing tens of millions of dollars to support our small businesses and offering sales tax payment delays where we can. Supporting individuals and families who rent their homes by banning residential evictions. Delaying income tax filings until July. Increasing and expediting unemployment eligibility, and expanding Medicaid coverage. There are countless people in our state agencies who are working behind the scenes day and night, 7 days a week, to find every possible mechanism to support our working families. They will not stop until this virus is defeated. Let me take a moment to highlight the work of one of those groups of public servants, the women and men of the Illinois Department of Financial and Professional Regulation, which has played a key role in so many of our efforts to soften this virus's financial impact. We've paused the repossession of vehicles. We've asked the 3 major national credit bureaus to refrain from negative credit reporting at this time. We've assisted state credit unions and banks in navigating the distribution of U.S. Small Business Administration loans. We've urged those same institutions to offer payment forbearances and waive late fees. And we've called on mortgage lenders, servicers, and banks to grant 90-day mortgage forbearances. That ongoing work brings us to today's announcement. The Federal CARES Act provided much-needed relief for those with federal student loans who are struggling as a result of the COVID-19 pandemic, including automatic suspension of monthly payments and interest and halting involuntary collection activity until September 30th of 2020. But that federal action left out the millions of people nationwide who are repaying private and non-federal student loans. These are people just as affected by the financial turmoil of this pandemic as their counterparts who are covered by the CARES Act. I'm happy to announce today that, as of today, nearly 140,000 more student loan borrowers in Illinois will now get relief. IDFPR has worked tirelessly to secure loan relief options with 20 student loan servicers, allowing borrowers to request a 90-day forbearance, waived late fees, no negative credit reporting, the pause of debt collection lawsuits for 90 days, and enrollment in other borrower assistance programs. These servicers include Navient, Nelnet, Ed Financial, LendKey Technologies, Upstart, Mohila, and others. IDFPR worked with other jurisdictions to create this multi-state agreement, which was negotiated to include borrowers in Illinois, California, Colorado, Connecticut, Massachusetts, New Jersey, Vermont, Virginia, and Washington State. Impacted borrowers can immediately contact their loan provider to get relief with these new options. This is new, so even the lenders are getting up to speed on this. So if for any reason a borrower experiences trouble securing the agreed upon relief from their provider, you should reach out to the IDFPR Division of Banking, the Office of the Illinois Attorney General, or the U.S. Consumer Financial Protection Bureau. Contact information for all 3 of those enforcement agencies is available on our COVID-19 website, and that's coronavirus.illinois.gov. I'm so proud today to share another critical update from another of our agencies, and that's the Department of Human Services. Illinois requested an expansion of benefits to help put additional food on the table for all Illinois SNAP households with school-aged children, more than 300,000 in all. And that expansion has now been approved, delivering an additional $112 million in food assistance to children across the state, with distribution that began yesterday, April the 20th. For families already receiving SNAP benefits, this increased assistance will be automatically added to Family Link cards. There's no need for you to call or visit an office. Households with school-aged children who are eligible for free or reduced meals when school is in session but do not currently receive SNAP benefits will be able to submit a simplified application for this assistance soon. And I'll be able to provide more information on that process in the coming days. No child should ever have to worry about where their next meal is coming from. And that's been a goal of my administration before this pandemic, and it's more important than ever right now. This change will make a real difference for 300,000 Illinois households who will have a little less to worry about when they go to the grocery store. I want to applaud our team at DHS who are doing whatever is necessary to get Illinois families through this COVID-19 crisis. So I want to thank everybody that's here today, and now I'll turn it over to Dr. Ngozi Ezike for today's medical update. Doctor?
Good afternoon, and thank you for the media members for covering these press briefings every day. It is vitally important that we get this message and these information out to the public so they can make informed decisions. So thank you for your work. I also want to salute and give a nod to all the lab professionals throughout the state. It is National Lab Professionals Week. And so as we think about all the COVID testing as well as all the other testing that goes on in the labs, I salute and thank all the lab professionals for their hard work. Today I'm going to give a lot of numbers, a lot of data updates. I'll start with the number of new cases resulted over the last 24 hours. That is 1,551. That brings our statewide total to 33,059. Unfortunately, I have to announce 119 new fatalities, which brings our toll of fatalities to 1,468. Because of the severity of the illness that this virus can cause, we have been monitoring our healthcare capacity. We're following very closely the hospital admissions, the people who are in ICUs and that are on ventilators. As of last night, 4,776 individuals in Illinois were hospitalized with COVID-19. Of those, 1,226 patients were in the ICU, and 781 patients were on ventilators. 30% of hospital ICU beds across the state are open and available should anyone need intensive care. Of the ICU beds that are currently in use, 55% of all of them are being used by patients with COVID-19. It's also important to note that 60% of all the ventilators in the state are available for use. Just over half of the ventilators that are currently being used by patients with COVID-19. As we continue to collect and analyze the data, we are seeing that people are recovering. As we continue to survey individuals with COVID-19, we have found that 54% of the cases reported to public health less than 2 weeks ago report no longer having symptoms and being recovered. For those who reported a positive test 4 weeks ago, 77% of those reported being recovered. This is encouraging news, and I hope it will strengthen our resolve to continue the very tough sacrifices that we continue to make. We must continue to stay at home. We must continue to wear our masks if outside. We must continue building on the progress that we have made and sustain it. Let's keep being all in, Illinois. And with that, I will summarize comments for our Spanish-speaking population. Buenos tardes y gracias a los reporteros que cubren estas sesiones todos los días. Es importante compartir esta información al público para que puedan tomar decisiones informadas. Gracias para su trabajo. Hoy voy a compartir algunos importantes datos. Reporto 1,551 casos nuevos de COVID-19 y en total 33,059 casos totales. Y con gran tristeza, reporto 119 nuevas muertes. En total, 1,468 muertes en el estado. Este virus puede causar graves enfermedades y tenemos que controlar nuestra capacidad en los hospitales. Desde anoche se informó que 4,776 personas en Illinois fueron hospitalizados con COVID-19. De ellos, 1,226 pacientes estaban en la ICU y 781 pacientes estaban en ventiladores. El 30% de las camas de ICU en todo el estado están abiertas y disponibles para personas que necesitan cuidados intensivos. De las camas de ICU que se utilizan, el 55% son pacientes con COVID-19. El 60% de los ventiladores en el estado estén disponibles para su uso. Un poco más de la mitad de los ventiladores que se utilizan son utilizados por pacientes con COVID-19. Sin embargo, a medida que continuamos colectando y analizando los datos, estamos viendo que las personas se están recuperando, aunque está tardando un poco más. También continuamos encuestando a personas con COVID-19. Hemos encontrado que el 54% de los casos reportados menos de 2 semanas informan que ya no tienen síntomas y se sienten recuperados. De los que fueron reportados entre 2 y 4 semanas, el 61% reportó recuperados y el 77% de los que fueron reportados más de 4 semanas reportaron recuperados. Estos son buenas noticias y espero que ayuden nuestra determinación a continuar los sacrificios que estamos haciendo. Debemos continuar construyendo sobre el progreso que ya hemos hecho. Sigamos luchando juntos para Illinois. And with that, I will turn it over to Governor Pritzker.
Good afternoon, Governor. Elizabeth Matthews, pool reporter, Fox 32.
Good afternoon, Elizabeth.
Guess I'll go first. So the models are showing, you say, that maybe our peak now, what was thought to be maybe mid-April, might now be mid-May. Can you tell us about that? And if that's the case, why hold off on extending our stay-at-home order?
Yeah. So we'll be talking more about our models in the coming couple of days, but suffice to say that we're working hard to try to make changes to the stay-at-home order. But we are in the stay-at-home order now, so I think I've given enough information to people so they understand that the peak is still yet to come. We need to be careful, but I wanted to give our staff and and myself enough time to have conversations with the epidemiologists and the experts and people in different industries to try to understand what we could do, not just in the very near term about changing the stay-at-home order in some ways, tweaking at the edges and trying to make it easier on people, but also what we will do going forward if in fact the peak comes in mid-May or whenever that may come. We need to have 14 days after that, as according to many of the experts, so where the numbers are going down. So we're looking at all of those things and working on it now.
So just as a follow-up, so say if we don't hit that peak until mid-May, do we have to be in your belief, do we have to be in a stay-at-home order until we hit that peak?
Well, again, we will be making some changes to the stay-at-home order as it is, but it is true that it is working. And so to pull it off, a stay-at-home order, it seems to me, to remove it, as I see some other governors may want to do, to remove it entirely is to simply open everything back up to infection. We heard Dr. Ezike saying in the last couple of days that the number of people that are getting infected by a single person who is infected has gone down significantly since we put the stay-at-home order in place. That will go right back up again if you remove all the restrictions.
Gotcha. Can you give us an update on McCormick Place? Number of patients that are there currently, all COVID-19 from our understanding, either you or Dr. Ezike. Number of patients, how many have been treated total? Is the 3,000 beds, is that still in place for Friday? And if it's not, do we need those beds? Do we halt the assembly of that?
I'll give the non-medical part of that answer, which is, we're looking at all of the plans that we put in place. Remember, the original projections for our state were that we were going to see, before the stay-at-home order and even right after the stay-at-home order, the projections, even the public models, which aren't that great. But even those public models, as well as the private ones that we were looking at, showed us off the charts, and needing a lot more hospital beds than exist in the state today, which is why we've been building up the hospital capacity within each hospital, in addition to having these alternate care facilities. So we were preparing and working very hard to make sure that we have all the beds that we need. I'm hopeful that we won't need everything that we've made plans for. And you've asked about the one facility, McCormick Place. I'm hopeful that we won't need to, build out every part of that. But we did want to be prepared, and we still do, because one of the challenges that we have is we don't really know. A model is simply a model, and you have to actually get to the peak and start down the other side of it before you know that you've hit a peak.
So April 24th, was that the date for the 3,000 beds? Is that correct?
Yes, I think that was April 24th is Friday, I think. Is that right? Yeah.
So we're going to hit that?
Well, again, we're looking at making a few adjustments to that, but we'll make announcements as that happens. We're looking at making some adjustments, but still we would have significant capacity at McCormick Place going forward, just in case, not knowing where the peak really will end up.
And then another question about McCormick Place that maybe you could answer: the cost of keeping it up every day. Do we have that projection?
I don't have that projection for you, but certainly we'll be providing all of that. And remember, some of that cost, much of that cost, will be borne by the federal government, which in the CARES Act provided funding for states to pay for coronavirus expenditures, as well as for hospitals. Some of that will get covered. And then even our National Guard, which was very much involved in that, will have reimbursement for their expenses.
Okay. Dr. Zike, would you like to comment about how many patients are there now? How many have been treated there, and where are they coming from? What hospitals or what regions?
Yeah, so I think it's a wonderful testament and testimony to the amazing leadership that we've had here under Governor Pritzker, that we have had ample resources, ample beds available for anybody who developed COVID-19, and in preparing for the worst situation, but aggressively working to make sure that that wasn't a reality, we have not exceeded bed capacity throughout the state. Our hardest hit area, as probably people know, has been the Chicagoland area, Chicagoland, Cook County, and the surrounding collar counties. And so we've had a few patients, less than a dozen patients that have been transferred from Chicago area, more Cook County and surrounding county hospitals. Less than a dozen patients have been treated at McCormick. And again, a testimony to the fact that we made aggressive moves in the beginning that kept us from realizing the expected peak.
Okay. Thank you, Dr.
Yeah, can I just remind you that the consequence of being underprepared would be the loss of life, and the consequence of being over-prepared would be that we built out more than we may have needed, and nobody can know exactly where we'll end up until much after we've hit the peak and moved off of it.
This is from my colleague Mike Flannery. The New York Times has a front page story today reporting it could take years before New York City completely recovers from the pandemic. Speaking of particular theater, restaurants, tourism-related industry. Mm-hmm. Are we going to see that in Chicago as well?
Well, I don't know, and I don't think anybody really knows, but I certainly have said to you that I think if we can get a treatment and a vaccine, ultimately, that the damage that is suggested by an article like that wouldn't be visited as dangerously or as difficult on the economies of our states. So I can't really answer it. I mean, we can see what's happened to the economy already in this short period of time. I'm hoping that we'll be able to recover much more quickly than is being suggested by that.
This is from Univision for the Governor and Dr. Zike. We have a number of concerts that were set to take place in the month of May. Is it safe to say that they're canceled?
I think I just did read, actually, that a number of them were canceled in Chicago. So I think that probably answers the question.
From Eric Hong with ABC7, even as you begin to reopen businesses on May 1st, are there enough hand sanitizers, cleansers for a lot of these businesses, especially small mom and pop places? Large companies can't even get their hands on enough hand sanitizers and cleansers. Is there enough of that type of material to be able to help businesses reopen?
Yeah, so I want to caution that I don't think there's going to be some mass opening of lots and lots and lots of businesses on May 1. But to the point, do we have enough hand sanitizer or dispensers? I don't think anybody has been fully prepared for this. And even each industry, as it looks at, and I've asked industries to do this, to look at, how would you reopen? How would it work? There's no doubt that hand sanitizer and the use of PPE is going to be an important part of that. Will businesses provide PPE? That's a question. Will hand sanitizer be available to everybody that walks in the door? Should it be required? I agree that right now, I don't think anybody would say that there's enough of that going on. We're also going to have to develop some norms, that people just understand that, as you're walking into a place, getting hand sanitizer and making sure that you've used it, or making sure your mask is on as you enter someplace. I think those are all things that people are going to have to get used to, and businesses are going to have to adjust to make sure that their customers are protected.
Last question from me. A lot of people have been asking about this, and other states are starting to open. Obviously, other states are in different, phases when it comes to this. Golf courses. People are so anxious just to get out on the green, to be outside. Golf courses, maybe you could do it in a socially distant kind of way. Is there any talk about opening up those type of sectors when we go into that? Does that all kind of come into your decision making?
Yeah, we're looking at lots of things like that. We understand summer is different than what we've had up to now, which has been colder weather. We want to consider all of those things. That's just one of the many, many things that we've tried to take into consideration. But I do want to remind everybody that, once again, we have bent the curve because we have had a stay-at-home order. And so the fact of a stay-at-home order in general being a very positive thing, before we ever have enough testing, because there isn't enough testing and there won't be for some time, to really open everything up. And the fact that we're going to need, a whole lot more, means we have to leave things, still in a place that seems, not normal to everybody and won't be for some time. But we're going to work hard to make it more normal and make it easier for people. And certainly we want people to be able to get outside and enjoy themselves.
Okay,
Thank you very much, Elizabeth.
Go to questions from reporters online. Shia from Politico asks, we see Senate President Harman has asked for financial aid from Congress. To what extent are you asking for financial help, lobbying Congress members, talking on the phone? How many people are assigned to these tasks?
Well, I don't think there's anything that can be more effective than a governor calling another state governor and talking to them about reaching out to their delegations. A governor does have the ear of members of their delegation. And so I've made many, many calls like that on behalf of our common interests in all the 50 states to get the federal government to help us with support for our states and for the industries in our states and so on. I do that quite often, and a number of members of my staff have also been on the phone with staff members of those various representatives and senators across the nation.
Bruce Rushton from Springfield Times. How much has the state spent on former Vibra Hospital in Springfield, and can you break down the costs paid between the building owner and the operational and remodeling costs?
I can't do that for you right here at the podium. I don't have it in front of me. But at this moment, there's been no work done on Vibra, so at least that part of any expenditure has not been undertaken.
Pete McMurray at WGN Radio. For Dr. Ngozi Ezike, how worried are you for a second wave of COVID-19 this fall?
I think we should be concerned. Obviously, we're following information and data that's coming from all around the world. We know that the fall is already traditionally an established time for flu outbreaks and flu. So the flu is our epidemic that we see on a scheduled basis. So if there was supposed to be any resurgence, we could see why that would be at that time. And so if you had COVID as well as flu, it's very concerning that could be a significant second wave or a second surge. And so that's why, without a treatment, without a vaccine for COVID, those two overlaid could be very problematic.
John Kraft asks, have either you or the IDPH director issued a directive that anyone who tests positive in another state with a residence in Illinois be counted as an Illinois case?
So there are rules on how to count cases, and we've had many situations that were a little complicated where an individual was maybe on vacation here and was found to be positive, and so later we had to adjust the count and shift that to another state, and likewise people who were outside of Illinois but who had their primary residence, that was so those changes are made as we identify what the primary residence is.
Those are relatively few and far between as far as I have seen.
Ben Cox at WLDS in Jacksonville is asking about IDOC redeploying guards and staff from a West Central Illinois prison to Stateville. IDOC couldn't confirm the numbers and from where, but how long has this been going on in terms of having people work at different facilities?
It's only done when there are not enough workers at a particular facility. So I can't tell you exactly how long, but it's in the weeks, let's say. Time period, but we want to make sure that everybody is safe in each of these facilities, and that's one of the reasons that we've made sure that we have enough staffing wherever it may be needed, because some staff end up needing to be quarantined or needing to stay home because they're ill.
Jamie Monks at the Tribune says, you're predicting Illinois will reach its peak in mid-May. What models are you using to reach that conclusion? And can you expand on what reopening plans vary by region may look like for Illinois and specific differences you're considering?
We'll be talking more about our curve that we've been using and continue to use, and in the very near future, and I will obviously from that we'll be talking about what changes will be made, and and how we might think about what the future opening of different kinds of industries and businesses will be.
Kelly from Block Club, if masks are required in cities like Chicago, how will your administration ensure everyone, particularly low-income people,
Good afternoon, everyone. Before I get started on any kind of briefing today, I would like to just take the time to do a official part of my job today, and it has to do with signing a bill. One of the priorities we had in the governor's office, so we're in a little unusual circumstances today, but everybody's here. But one of the things that was a priority of the governor's office and many of the legislators was to do House Bill 1511 and 1452 into law, which is the military reciprocity bill that we're going to be signing here just in a few minutes. I want to thank Representative Steve Lynch for helping with this bill, Representative Nick Schroeder for the co-sponsor of it, Senator Justin Brown in his area, and Senator Bob Onder. All of them had a lot to do with this bill, but it was a great honor for me to be able to get this through the legislation today, especially as a veteran. And one of the things we do know when the spouses come along with their military families, how important that is. And number one concern that the spouses have is what are they going to do about jobs when they get here. So with the reciprocity bill we're doing today, we're going to be able to do a lot of pieces of the legislation, and the certificate part of it we're going to get to not do for those spouses, and they're going to be able to go to work a lot faster than what it had been in the previous. And so we're going to be able to waive a lot of that bills there. But military advocate Joe Driscoll's here today. Joe has did a tremendous amount of work on this. Me and him was in Fort Leonard Wood and across the state talking about this before the COVID-19 issue. But I'm going to let Joe come up and say a few words this morning. Joe?
Governor, thanks very much. I'm very happy today to be here today on behalf of the 16,000 active duty service members, their families, and especially their spouses to thank you for signing this really important bill. Your signature means that Missouri joins 14 other states around the country. There are now 15 that provide this full license reciprocity for military spouses who move from one state to the other. Thank you again for making this one of your priorities. I think it shows as to your commitment. I also want to congratulate Representative Steve Lynch and Senator Justin Brown, whom the governor made reference to a few minutes ago. They had some dogged determination in order to get this bill passed and to get it done before the legislature went home for a while. I'm proud to note that this was the first bill to pass during the session and one of only 2 non-appropriation bills that the governor's been presented with this year. In a nutshell, what the legislation does is allows active duty military spouses who hold professional licenses in other states to become licensed in Missouri, and even allow them to make application for those licenses before they get to their new duty station here in Missouri. In the past, the state only issued courtesy licenses, that is, licenses that were temporary, and then those military spouses would have to provide further evidence of their education and qualifications to licensing entities. The new law is important for 2 reasons. One is it shows that we're being a good partner with the military. We have lots of military installations and locations in our state, and it is very important that we underscore our commitment to them. In fact, I know Secretary Mark Esper and the military service secretaries are paying very close attention to which states do and which states do not enact this legislation. And in fact, they've indicated that this will be considered in future basing decisions when they're talking about locating military missions and in additions to what they have around the country. The second reason that this is very important is when our economy starts returning to some sort of normal footing, these military spouses possess the expertise that we need in order to fill the jobs that our state had available just a few weeks ago when our economy was normal, and indeed will be returning to that normal situation again. Governor, as you made reference, I'm thinking back to January 21st when you made that trip down to Fort Leonard Wood to visit with the spouses of soldiers and Marines and airmen to get their views on what it was like to live in Missouri, and perhaps to get their views on quality of life here in the state and what the state could do to do about that and improve it. And I know they appreciated you asking the question, but it was really clear from their unvarnished comments that they thought probably the most helpful thing that you could do was to make sure that they could work in their chosen professions. I think by signing this legislation, you've not only gone a long way to improve that quality of life and meet their expectations, but you've also expanded our professional workforce, and made our state an even more friendly military place to be in this country. So I thank you. I think this is a great addition to the laws in Missouri, and it'll have good, long-lasting consequences. Thank you very much.
Joe, thank you very much. Thank you for all your hard work. I'm going to do the official part of this real quick, so Kelly, if you want to hand that to me, and Joe, if you want to come over, just keep the 6-foot distance, and we'll sign this into law. That makes it official for all of us. Also today, Dr. Williams is here today. Director Williams, Dr. Williams, a lot of those titles he has over there. He'll be here to answer questions today on any things you might have on testing, any of the plans we're going to do to increase testing. He'll be here to answer that. Director Carson's also here to answer anything on the PPE side of it, the law enforcement side of it, to take questions about SEMA or FEMA. Today earlier, we've been working on, actually I talked to the federal delegation earlier this morning about kind of their plans of about the package they think is going to be coming down that they think they're going to get passed today in Washington, D.C. We'll see. They had high hopes for that when I talked to them. Some of the things will be coming our way. And then I think the other thing, we had a long discussion with them of our plans about reopening Missouri and how we were going to start the process of that. Again, last week when we made that announcement, we've been working full steam on that, trying to make sure that we're getting things in place, some guidelines for the people of Missouri. And I think the two things we're focusing on this week, our two priorities, is COVID-19, still doing what we can against the virus, and then making the plans to reopen the state of Missouri. So with that, let me just give you a little update on the COVID-19. As of 2 p.m. today, there have been 5,941 positive cases of COVID-19 in Missouri, including 189 deaths. Over 57,000 people in Missouri have been tested so far. So that's the update on that. So with that, Kelly, let's just open it up for questions. Yeah, I think you're going to see, we're going to take a look at open, we're going to look at recreations, we're going to look at sports, all the possibilities to open up the state. We're going to take a look at those things. I think one thing you're going to see is the guidelines of social distancing. That'll all play part of how we're going to open up the state. It'll be part of it. But all those things we're going to take a look at. We're right now in the process of kind of giving guidelines that we've got that we're working on every day. We hope to talk, and again, we're working on the guidelines. When I say we are working on that, we're talking to county commissioners, we're talking to mayors, we're talking to executive directors, we're talking to the restaurant industry, the manufacturing industry. A lot of people are having a lot of input into this of how we foresee that we're going to be able to open up the state of Missouri and still make sure that we got the consumer confidence out there that it's safe to be out there. I will just say this as we work through this process. I think it's important to realize, no matter what the regulatory side of it might look like, I think we're a long way from people just all of a sudden going to leave their homes and go out there and feel like it's okay to go out into crowded areas and things like that. I think there's going to be a lot of self-discipline to that, to the everyday person. But what we're going to try to do is build the guidelines to give it to the counties, the cities across the state. That's a blanket policy. And then they're going to be able to, if they want to do something a little bit more stricter, they can. Upon that. But what we really want to do is give everybody the guidelines to start the process. So if the county wanted to issue an order, is it still being in effect after your order expires? I'm sorry, what was the first part of it? If a county issues an order, would it be in effect after your order expires if the county wanted to? Well, if the county does an order, whether they do it now or whether they do it after the new one, they can do stricter guidelines. So they could have one in place. It was stricter guidelines of what we can. It just can't be any less guidelines than what we are. Yeah. You'll have to step up here. I can't hear you that far away.
Do you have an ETA on beginning phase 1 of reopening
Yeah, we're working on that now as we speak. We're working on it. So we hope sometime towards the end of the week we'll kind of finish up the guidelines of it. And then next week we hope to be able to put that out to, we're going to want to put it out to the county commissioners, the mayors, and the people in the local areas as soon as we can. But we hope by next Wednesday we'll be at the point where we'll have things pretty well in place for people to view that.
Governor, overturning people gathered outside the Capitol today, asking for you to reopen the economy. They did single you out specifically to say that your stay-at-home order went beyond your constitutional powers and to say that you were infringing on their liberties. How do you respond to that criticism?
Yeah. Look, we've been doing this for weeks now, for months. We announced last week we were going to open up the state. So I mean, I get them protesting today, and that's fine. They have every right to do that. But what we've been asking people all along is to stay home. That's what we're simply doing and going with the guidelines of the state. They have every right to be out there. We announced last week we're going to open the state. We haven't changed it. We're going to continue on that plan. Yeah, I just learned about that today, much like I just read it earlier today. I was informed that took place. So, I'm not sure what that's all about. I mean, it's evidently we're going to sue China for that. So I'm not for sure what the Attorney General was. I hadn't talked to him about that, but that's fine. I'm going to let Kelly kind of do the question that way. And let me just. Yep. Let me just say this. I'll make sure everybody today, I'll be down here that where everybody will get to ask their questions. So we'll just kind of go through this as we can. Michael?
Governor, can you be a little more elaborate on the description you just gave us in terms of safety municipal? You talked about parks and recreation. Can you flesh that out a little bit? And the other thing that's part of this is sort of briefly. Were you able to hear the protest today?
I was not. I mean, we've been busy all day today. I've been on conference calls and meetings all through the day. Matter of fact, I seen them out there somewhere, I don't know, this afternoon or something, but it's a pretty day out there. It's a beautiful day. I kind of envied them from that part of it, but that's fine. They're out there protesting. I mean, we get people protest the Capitol all the time. And so the first part of the question was, get into a little more detail. Okay, look, for the most part, we're going to try to open things up. I want to be careful saying everything. We still got to deal with things like the nursing homes. We got to look at things where there's high risk. You still got casinos we're part of discussing. The majority of the businesses, especially the service area, whether that's restaurants, whether that's beauticians, whether that's barbershops, whether those are box stores, will all be open in our guidance. We'll give them the opportunity to open. After May the 3rd, yeah. And I think the other thing, in fairness to the business of the state, as I've often said, it's very difficult just to go out there like on, say, Sunday, May the 3rd, all of a sudden I say, okay, you can open up tomorrow, and they're not for sure. It's going to take a little bit of time to get people back to work. They're going to have to call employees back in. They're going to have to get supplies for a lot of them and things like that. So, again, it's why it's important to me to work with the associations and to work our way through this. But there's a plan in place, and I think we're going to be able to execute that plan. And then it'll be an ongoing process. So I don't want to think just because the way we open up, let's call it phase one, whatever you want to call it. But, we're going to have to work our way through that and make some adjustments and see how we do this. But for the most part, we're going to open up businesses in the state. We're going to put as many people back to work as we can.
KSDK. Governor, you've been emphasizing the importance of social distancing. Dr. Williams, you have as well. Today, many of the protesters were in crowds and they weren't wearing masks. What are your thoughts on that? And Dr. Williams, if you could just answer this as well. Was that potentially a dangerous situation?
Yeah, Dr. Williams, come on up. You can answer that.
Thank you for the question. Yeah, again, the virus doesn't differentiate between why you're gathering. It doesn't know the difference. And so we just, strongly for your own safety, that, as the governor said, to protest is fine, but you need to do it responsibly. Because as we've said all along, and the governor said all along, it's not, not only you who could get infected, but you could infect others. And so we would just, at any type of gathering, and people call me and say, can I waive this, can I waive that? And I go, I'm really thinking about you when I say, no, you really need to practice social distancing, whether it's, again, less than 10 people, 6 feet, and if you're in a situation where you can't do that, then wear your mask. But that's for your protection, as well as those around you, your loved ones and others.
Doctor, do you think that protest was safe?
Yeah, you know what? Well, I have not, but my staff's working with him daily on that, and they're briefing me on that. But I think it's important to know that the stimulus money, part of the stimulus money, has arrived. About half of it's here. There's still a half of it we're waiting on. The 24th, they're supposed to have the complete guidelines on that. So shortly thereafter, once we get that, we'll be trying to make the process through their role and through the office they're much more on the advisory role type of it, just trying to go through this. And it's really just about work. It's about having the people able to go through this. Why I asked the treasurer to go through there, it's just simply because our office is pretty overwhelmed right now with the unemployment, all the other things going on. But again, we're just reaching out for help, so it's on that.
And I believe Jacqueline asked you this yesterday, but I'll ask again, what is the latest with the fiscal year 21 budget? And when might we see some of the...
Yeah, you know, the legislature is going to be in here next week to work on the 21 budget. You know, I think one of the things we got to realize is we're not for sure what the federal stimulus part of that's going to be. So that's kind of the big unknown out there, what they're going to come in to help. And what they're going to do, are they going to be in to help with part of the tax revenue loss for the states and the cities and the counties? We just don't know that yet. So, you know, time will tell us on that, but I think you have to prepare the state for 21. I mean, it's going to be on the negative. We know that, so we're going to have to prepare for that. It's going to be several $100 million that we're going to have to figure out how to get out of the budget to prepare for 21. However, I have talked to several people on some of the financial people. They think there's a good opportunity for the fourth quarter this year, things in the third and the fourth quarter, that maybe the economy can come back pretty strong. So, you know, we hope that's going to happen, and maybe that changes those numbers. But for right now, we have to balance the budget. It's just that simple, and you only got so much money to do it. So I think it's important that people know that, because whether you're a small town in Missouri or a county, thinking that maybe the state's going to be able to come out there and help us out, to bail us out of some of this, I'm not sure that's going to be possible. So again, it's back to the federal stimulus money. That's the big unknown out there. But everything on the federal money that's coming is pretty well related to COVID-19. So it just has to be paid for that, and you're going to have to make sure that the receipts, and you can prove that whatever those reimbursements are, go to that.
Governor, the state of emergency and the social distancing and everything that's gotten us to where we are now, was any of that avoidable? Could it have been done any other way? Why or why not?
Yeah, I didn't hear what the question was. I'm sorry.
The state of emergency and the social distancing, everything that's gotten us to where we are, to the point of some of the protesters outside today, was any of that avoidable? Could it have been done another way, or if so, why or why not?
You know, look, Missouri's going to have to use common sense here and be smart about this. The majority of the Missourians are doing what they're being asked to do. We know that just because we've seen the curve on the coronavirus. There's 6 million people in this state. Let's just be realistic about it. There's not going to be somebody out there that can separate somebody to make sure you're 6 foot apart all the time, everywhere you go. You know, we got to take that responsibility on ourselves, and people in this state do, and I think they will, because I think the majority of people is going to think of their own safety also, and the concern of that. So I think Missourians are going to step up to that challenge, but we're going to continue to recommend some sort of social distancing as these orders go through and these guidelines go. They'll be part of that. No, I'm not saying that. The legislators, they've got a constitutional obligation to do it by the May 8th, and that's what they want to do. And that's fine. We can do that. What we don't know is how much stimulus money is going to come in. That could very well maybe come in June. It may not come in. So the work they're going to do between now and May the 8th to get a budget done, they're going to craft that. We'll see what happens. If something changes drastically, then we'd call them back in. Then I'd call them back in for special session. Yeah. Well, again, that's up to the legislatures I'm not sure what all their agenda is going to be on there, the House and the Senate. You know, really right now we're focused on the COVID-19 from my office, the unemployment issues we're having. We're working on the mental health situation, making sure the corrections There's just a lot of things we're trying to do. One, these models we've been doing for weeks. It's a lot of time. I'm not sure what the legislators are going to come up, what they're going to try to pass, or if they're going to try to pass anything, other than I know the main reason they're coming up here is for the budget, is what we know, and we're going to try to give them as much information we can to help with the budget process. Dr. Williams.
Thank you for the question, and we're intensely looking at that right now. I just got off a phone call with the White House with Ambassador Burks and Admiral Giroir. So, as you know, this is all changing very rapidly. We now, and LabCorp announced today that you can do at-home testing that they're going to make available. There's saliva testing that's coming on board. But to your question, what is the prevalence? And so you're seeing some research coming out of Santa Clara County, some research coming out of LA, looking at that. There was a study, not a study, a survey closer here. And so that's one thing we're very interested in, and we're going to talk more about is, obviously the way you normally do a seroprevalence study is with antibodies. But we won't have that capability for about 3 weeks. So we're looking at other ways to answer the question exactly. I will tell you that if you look at the very limited research nationally, people would quote a prevalence of about 2%, maybe 3%, including asymptomatic people and symptomatic people. So I think that's a number we kind of walk around with. But obviously that number is going to be very different for Worth County and Gentry County, I believe, than it is going to be for St. Louis County and St. Louis City, where we have half of our cases. And so when you talk about it, it's going to vary around the state because it's a very diverse state. So we're very interested in that as well for the reasons we've talked about. It would help people know if they think they might have had it, but they never got tested. It would certainly help our first responders. And it also helps us, we've always committed to this being science-driven. That's why we do so much testing. And antibodies and prevalence studies using PCR will give us more information. As we transition into recovery, it would be very helpful to know that very thing, and we have a plan to kind of get us there. No, but we're working to find that out. We're working to get there. And since I'm up here just real quickly, I want to thank the governor for signing this bill today. I was at Whiteman Air Force Base about 9 months ago, and when I toured their medical facilities, which are excellent. And when I asked them what would be the one thing we could do to help you, it's that very bill that was signed today. Many of those spouses are in health care. Some of them are teachers and other things, but many of them, both men and women, are in health care. And so, we have 500,000 veterans here in Missouri, and as Joe said, we have 18,000 active duty. And that's really probably, they would say, one of the kindest things we could have done for them was to get that done. So thank you, Governor, for doing that.
Right here, microphone. Michael, you'll get your chance in just a second. Michael, just a second. Go.
For the governor.
Governor, this will be for you.
So earlier in this crisis, you actually ensured that the entire state of Missouri will be eligible to receive the SBA Paycheck Protection Programs. And last week, the director, Rob, I forgot his name.
Dixon?
Yeah, yes. Director Dixon said about 46,000 of small businesses in Missouri got received those benefits, but that's actually less than 10% of the entire small businesses in Missouri. So do you have any plan or thoughts in place that would ensure that every business who apply for the program to get the benefits, sir?
We hope so, as long as the money's there. That was one of the things today. There's more money coming out for that. If that was a question you're asking of the ones that haven't got it yet, well, if they just run out of money is what happened. So they're today, my understanding, talking to the federal delegation, that they believe they are going to pass a bill that will have more additional funding for that small business.
Do you have any number of businesses who have applied for the benefit but haven't received the benefit yet?
You know what? I don't know whether they have or not, to be right honest about it. I assume that's in the process, but I know there's, I don't know. I'd have to check with economic development to find that out.
Thanks, sir.
All right, Michael?
Thank you very much for the questions. I've been working on that a large part of the day. As you know, in Missouri, certain counties will tell of the cases in nursing homes, and certain counties choose not to. And we try to respect that. But we learned of that last night, that CMS guidance now is that all nursing homes have to report cases. So I left the team when I drove over here today looking at that very issue. Would it probably make sense for us to report all of the nursing homes that statewide instead of leaving it up to the county? And so we're looking at that today. So that's very much on our minds about that. Again, a huge point of emphasis going forward is our congregated facilities, such as long-term care facilities. And like I said yesterday, we worked on that all weekend. And think going forward, as we box in outbreaks, that's going to be something that's really important. We've changed our testing guidelines today, which we're going to talk more about tomorrow. But those testing guidelines we changed are very much aimed at your question. Yeah, we're very strongly considering it today. Yes, I'm asking. I asked my team today to research that, see what other states are doing. It's been an issue here in Missouri because some counties do it, some don't, and so we're looking at that today. Well, I wish we could do it that way. I think, again, just listening to Ambassador Burks on the conference call we just had, and we had all the labs on there, Abbott and Roche and all the other ones, because it was about testing. We are aware that the more we learn about this virus, that there is an asymptomatic component to it, that you probably are infectious 2 days, 3 days before you become most infectious when you're coughing and have respiratory symptoms. So we learn something new about it every day, but if that is in fact the case, as Ambassador Burks was talking about today, then that would mean what you just said you couldn't rely on, which is just wait till you start coughing, and that if you're not coughing, then you're fine. So.
All right, back over there.
Dr. Williams, does the state have any other priorities that are before funding local health departments?
Well, our number one priority is to save lives and protect health, period. And so, I think just to hark back, to an issue that came up working with our local health departments, we received some money, and traditionally we would have taken that first tranche of money and worked with, and sent that out, and we decided that we needed to spend it on PPE, to be honest with you. We just thought the most important thing. Now, our commitment to them is, as the governor says, we receive more money and we get federal guidelines, then we certainly realize that that is something they've been incredibly helpful with. But, I'm a doctor first, and the first thing we realized when we got that money working with Sandy was PPE was going to save lives. We'd have later to do other things, like fund health departments or whatever, but the most important thing was to save lives.
How will local health departments be chosen to take that money? Will it be where the most cases were, or will it be spread across the state?
I really haven't gotten to that, and I think back to the governor's point, I think that'd be putting the cart in front of the horse to decide that before we see how much money it is and what the guidelines are.
Dr. Williams,
yeah, Lucas.
Both last week and again today, that testing guidelines for the state have changed. I apologize if I missed this. What are the new testing guidelines?
Well, yeah, I hope to have them out for you tomorrow, but I'll give you a flavor of them if you would. We are going to move, first of all, to very much developing this boxed-in strategy around congregated facilities, and that's anywhere there's an outbreak. Because if you've noticed, we are not seeing as much community transmission. This is like the 12th day in a row we've had less than 200 cases, and we were seeing 300 and almost 400. So that gives us more capacity to test. But as Ambassador Burke said today, and Admiral Giroir, in the future, we're really going to have to focus on nursing homes. That's where much of our mortality is from and much of our morbidity. And so if you're going to do that, you start moving into what we call comprehensive testing. And very similar to what we did this weekend, in which you go in and you test a lot of people and you test them quick. One thing Ambassador Burks talked today is the possibility of doing sentinel testing, where sentinel meaning you're looking for people to kind of be a sentinel to let you know it might be coming. So I think that's the first thing on testing. Again, just to tip my hand, one thing we've gotten is just we had a guidelines in there about testing first responders, law enforcement. Well, one of the things was that you had to have known contact with someone. Well, first responders will tell you they're in contact with everybody. So I've been getting about 6 phone calls a day going, you know, I've got a highway patrolman who's got a cough and a fever, but he doesn't or she doesn't know exactly who she was exposed to. So we changed that today. And there are about 2 or 3 others that we'll put out tomorrow. But, you know, this is a dynamic situation. We learn something new every day. We're moving into a new phase. And so we always have to try to see that ahead of time and adjust accordingly.
Mr. Brooks?
Yes, sir. Huh? Yes, sir. Right. Thank you. Well, my order carries the force of law. So to answer your first question, if they deviated from that, then yes, that is a deviation from the law. You know, when you say bad judgment, I don't tend to be, as a clinician, as a doctor, you know, I didn't become a judge, I didn't become a lawyer. I'm more concerned about their health. That's my number one priority. So rather than judge them, what I would try to do is convince them that the governor, I think the most important thing we have to do in our offices is keep people safe and save lives. And so anything that I need to encourage people to do that, I'm going to do. I don't judge that. I'm just trying to help them. It does, by the force of law, it is a misdemeanor, yes.
Dr. Williams, can you explain how the local health orders are going to work after the governor's order expires?
Yeah.
Are they going to be able to operate under the same orders they're operating under now?
Yeah, I can't express it any better than the governor, which is simply, as he said, is that local health departments always have the ability to be more stringent. You've seen that in your, St. Louis. But they're not allowed to make them less stringent. Our orders supersede those. And so it's exactly as the governor explained it.
So they'll be able to keep parks closed if that's the best route?
Yep. They can make it more stringent, but under their existing orders, but they can't make it less stringent. Is that?
Does the state have enough PPE for healthcare workers and other workers to conduct the contact tracing and the testing needed to start reopening Missouri?
Yeah.
How much of each of those things does the state need?
I'm going to turn that over to Director Karsten, but to your point, one of the 4 pillars the governor has put in place for us moving forward is the ability to do testing and contact tracing, and so I'll let Director Karsten speak to that. But I think the wonderful thing we've done is we've got a runway here. We've got a runway of 2 weeks, and so we're having less cases now, which enables us to build capacity.
We are working in that direction every day to obtain more PPE. Today, the state just launched a website in which suppliers and those needing PPE can go onto and order PPE or locate a supplier for that. So again, through SEMA as well as DHSS, we continue acquiring more PPE every day, whether it's an order or whether that's delivery. So we're working in that direction. So thank you.
So how much PPE though is still needed?
You know, I don't have those exact numbers as far as what is still needed. I can just tell you it's a lot in millions.
How many days worth of PPE would you like to have in order? Part of this reopening strategy relies heavily on PPE being on hand. How many days worth of PPE would you like for those healthcare workers and even get to that first phase?
Ideally, as much as possible. We know that as a general rule, 14 to 30 days supply is the general rule. Thank you.
Okay, my question is for Dr. Williams.
Let me just answer a question on the PPE side of it. Some of the things we're doing on that. I think one, it's also important to realize that for a long time we thought we was going to get it out of the federal stockpile or the state stockpile. That's where everybody thinks. We're well aware now that the hospitals, the first responders, the fire departments, the police department, all on the local level have the opportunity to buy PPE gear now too. And so you're seeing that with a combination of what we're doing to build up our stockpile plus them. So the hospitals for normal rule would like to have, for example, maybe 14 days supply or whatever it might be, whatever their guidelines are that did tell you that. But I think that's changing daily as we speak along with the testing. I do mention one thing about testing too. I was on the phone today with the commissioner, I believe it was in Cass County, and also with Congresswoman Hartzler. They mentioned there was a company up there that now, and you maybe already know it, I just found out about today and we're checking into it now, that has offered to do 100,000 tests in that county. So that's a little bit of breaking news for us here in the state. Congressman Hartzler talked to me about that today. So that's good news if we've got a company that's coming online that can be able to do that. So I just wanted to add that on the PPE side of it. Dr. Williams, I think she had a question for you.
Yes. So studies have shown that COVID-19 is disproportionately affecting African Americans. You said that Missouri hospitals have a lot of them have failed to report that data. Have you seen a change in that?
Yeah, I asked that this morning, and I'm told that we were at 31% of unknown, and we're now down to 20% unknown, because I've asked us to go case by case for our deaths in Missouri, and if they're not being reported, then we're going to go find it. You know, you can find it. I mean, it's going to be on death certificates. It's going to be in cases. So I've asked my staff, Adam Crumless, I put him in charge of this, our deputy, to find me every case. I mean, I did this for 30 years. You can find that information if you look. I mean, I wish people by law would report it, but if they're not, we're going to go find it, because it very much demonstrates our strategy. And again, just to layer on what the governor said about the PPE, one of the things as we phase in is hospitals are going to want to do elective surgery. And to do elective surgery, you have to have PPE. So much of the onus, to your question, is going to be on them. It would be irresponsible to be doing elective surgery if you didn't have enough PPE to cover your emergencies. So that question will, in many ways, answer itself about what is the right number, because they are going to be required to have enough PPE. They can't be doing elective surgery if they don't have any PPE to cover their emergencies.
Did you say hospitals need to find that information on race, or they couldn't find money?
No, not find as in F-I-N, but find as in we're going to go find it. I mean, I've done chart review all my life. You can go find this information. We've gotten it down to 20%. We're going to keep going until we get it to 100%.
Another question about that. We're seeing in New York City that the governor there is putting testing sites in areas that are more diverse. Are there any talks about doing that here?
Again, it's been a busy day. We talked about that today. There's an area in Kansas that I hope by 5:30 I have the plan how we're already doing more mobile testing there. The governor, I had a great meeting with the clergy who pointed that out, and we've talked to Quentin, and so, but now we're going to add even more, and I'm very excited about that. We'll be talking about that probably in 2 days, but we're going to go into very specific areas. I was on the phone with the mayor of St. Louis today, and we talked about that. I don't think she minded me saying that Barnes Jewish told her they had 12,000 swabs. So that's very exciting to us, because that's kind of a critical component to doing testing. And so work very closely with her. As you know, we've opened up 5, at least, maybe 6 now, testing sites in North St. Louis County and North St. Louis City. And we just want to make sure that in those areas, but I'm getting a little bit ahead of myself, but to make up, we've been asked about seroprevalence. One thing we're very interested in doing is going into Kansas City and North St. Louis and looking at prevalence. And we have ways of doing that, through our testing, that will answer 2 questions. One, do symptomatic and asymptomatic people have exposure to COVID-19? So that's going to be one of our priorities, is to look at that, because we see more morbidity there.
Doctor,
Yeah, Lucas.
I guess 20% unknown. Would you mind sharing of those known cases how the deaths break down by racial demographics?
What I was told, I have not seen the data myself, was that it was, and I wasn't given a number, but that the majority were Caucasian. But how much of that majority, I don't know. Adam Crummels is the one that answered that question for me. I called him at.
Governor, we have time for one more question. Philip?
Governor, I think it was last month that the Department of Homeland Security put out the guidance of what is essential and non-essential. But can you kind of walk through for Missourians again how you actually reach those decisions in your stay-at-home order, how you concluded what is essential and non-essential?
Yeah, well, I'll go back to an issue that I was troubled with to a certain degree is who gets to decide who's essential and who's non-essential. I think that was one of the biggest issues that I faced as governor, trying to select who those people were, you know. And for me, when we open back up, to me, everybody's essential. Every worker is essential because, you know, so many times when you hear that word non-essential business or essential, when that all first started, look, everybody was scared. There's a little bit of panic in there, and we just started saying, okay, what is it we really need? So we started declaring non-essential businesses and essential businesses. What we do know now, looking back on it, again, every day you learn something. We know we were literally funneling people in to stores that were, quote, essential, was creating a worse problem because we were now bunching people up in the problem, or was creating more of a problem. Let me just put it that way. So here's the trouble I've always had with that. When you start thinking of a business, a lot of times we think of brick, mortar, and glass. The reality of it is that business belongs to some person. Some person works in there, and all of a sudden, some way, we decide who's essential or who's not. You're actually saying that person is non-essential anymore. And then you send them home, or you send them home to their family. And you almost, to a certain degree, say, what does that say about him and his family together? So it sounds good when we talk about it up here from a podium or we talk about it in the media, but the reality is we're making a judgment call on really who is essential and who's not in life in general, and that was something I've always struggled with. But when we reopen, we will be making sure that there's probably no, quote, non-essential business. We're going to take a look at it. We'll see what risk we have in all those areas, and we'll start targeting the risk, but we're planning on open businesses up across the state of Missouri.
All right, thank you.
All right, thanks everybody again. Appreciate it. I think we're going to do this, Kelly, Thursday again. Is that right? Okay. We'll be back here Thursday again. Thank you very much for being here today, everybody.